Bíonn Cormac or Margaret Cahill. Minister, thank you very much for coming in to talk to us this evening about Sláintecare. Hugely important initiative, one that has been talked about for a long time. The concept that we all support of universal health care being provided to people based on their medical need and not just on their ability to pay for that medical care. It's one that for our party is intrinsic and a huge priority, one that in the election of 2020 we campaigned very strongly on and made a very firm commitment that we would introduce and ensure a full implementation of Sláintecare, were we to have the opportunity to serve the people of our country. And that's what you and the other ministers in health are dedicating yourselves to do. I think it is really, really important as we have this discussion tonight, though, that we stop and we've talked about other individuals, but I think it's really important we all remember there's more than 70,000 people working in our health service. You know, they're all providing an input. They are all working to not just care for people's immediate medical needs, but to actually ensure that there will be universal health care there in the future. And I think it would be wrong of any of us to take from that fact. They have come through and they have served all of us during the pandemic. Fearlessly, they have put their own lives, their own families at risk, and they have done all of that based on their determination and their sense of public duty. So we all owe them a great gratitude and a great debt. And the COVID response, the pandemic, the once in a century event that it has been, everybody has played their part. But I do think in health, obviously, you've been on the front line. And despite that, and having achieved, you know, the greatest response in terms of public health, in terms of the vaccine rollout, the testing and the tracing, everybody who's been involved in that have served all of us. But on top of that, you have managed to, in parallel, progress Sláintecare. You have managed to progress 1.2 billion, I think it was, of new initiatives in the course of the last year, and secure for next year a budget again in excess of 20 billion. And that's really important because it's the sustainable funding of those 70,000 odd frontline workers and healthcare professionals that's really important. And I think it is also encouraging, and let's deal with the facts. 109 of 112 identified actions have been progressed or completed or are on track to be delivered. That mid-year review, and it's a year that the government is in place, that mid-year review of 109 out of 112, nobody is sitting on their laurels, I'm sure, Minister, in the Department of Health or the HSE, and everybody, I'm sure, is exhausted after the year you've put in. But that's some achievement, and everybody needs to be commended for that. I absolutely, and my party supports your objectives of reducing waiting lists, increasing capacity, and delivering the right care at the right time. And I think it would be honest for the opposition to remind themselves, or at least to acknowledge, that when it comes to talking about waiting lists, there is nobody in this republic that thinks the waiting lists are acceptable. Nobody believes that anybody in pain or in need of medical care should have to wait. But for the opposition party to talk about the waiting lists in this jurisdiction, where they are double per capita in the jurisdiction where they're actually in government, I think is pushing their luck a bit. In terms of next year's budget, Minister, I want to commend you in terms of the disability budget, 2.2 billion euros next year. And really in terms of, and this is one that comes to my heart, is what you have managed to achieve, the 92% reduction in the waiting lists for assessment of needs, particularly for young children. That is just tremendous. That's a historic achievement. Everybody who's been involved in it should be congratulated. And I really hope that next year we will see even further progress. And it's that type of progress that actually makes universal health care become a reality for people. When people can access health services that they need when they need them, that's what makes a difference. The 1.1 billion in mental health and the 2.3 billion for older people, they are all very welcome. The initiatives that you've taken in terms of trying to help people who are on low incomes access health care when they need it, the extension of the free medical care for 6 and 7-year-olds, the extension of dental services to medical card holders, and the reductions in the drug payment scheme. It's not the job done. We all know it's not the job done. But it is all going in the right direction. And we need to encourage everybody who's involved in this project. It's ambitious, it's radical, it is game-changing. let's not forget, our health service has been in place for decades. And this change, which I absolutely believe will be achieved, will also include a huge priority on women's health. And that's something that is really important to my party and to you, Minister. I know that. The initiatives that have been taken in terms of ending period poverty, focus on menopause, endometriosis, issues that are absolutely intrinsic to women, and free contraception. Minister, I want to ask just one last question. I would ask you to take an interest in the Rotunda Hospital, and they're waiting hopefully for approval of a design team for their critical care unit, the West Wing. It would be great if you could bring some good news, Minister.